My name is Kristin Finley. I'm a nurse practitioner with the palliative team or hospice and palliative care with the Oconee Memorial Hospital. I was born actually on the Jersey Shore, or right near the Jersey Shore, but spent most of my childhood in a town outside of Charlotte, North Carolina called Gastonia. Went to Appalachian State, so I guess I have to convert to a Clemson fan now, so we'll see how that goes this year. And then now we just recently moved down to the Easley area. Well, I originally thought I wanted to do physical therapy, but I did some rotations while I was in school, athletic training and physical therapy, and just kind of didn't get as much patient care as I wanted, so I geared towards nursing. And then I spent my nursing career with between a inpatient rehabilitation with oncology and brain injury patients, and then transferred to a level 1 trauma emergency area. So that was a big change, but I just realized how much I really missed being able to spend a little bit more time with the patients and having that relationship with them. And while I did a palliative rotation in my nurse practitioner schooling, I really kind of fell in love with that area because you get to spend a little bit more time with those patients and kind of really focus on them. What keeps me interested in palliative medicine is just most everything's not always the same, but you still get to build the relationships with those patients and with those families, and you just get to spend a little bit more time with them, and you get to know them on a different level than in some of the other areas that I had been in. So I really enjoy getting to know them and spending that time with them. I like to talk a lot, so I feel like that was a good area with me, and getting to build a relationship and actually know them. So I feel like I have a good connection with people, and I feel like that skill set is pretty good with the palliative care. I guess my style of practice I don't know if this is technically a style, but I try to be more personable with it. I like to be just kind of, I don't want to beat around the bush with anybody. I want to be direct and get to the points that we can work together to get to the goals that they want to get to. I chose Prisma because I kind of knew Prisma before it was Prisma. I knew the Greenville healthcare system previous to that. I did the Dragon Boat Festival for quite a few years. I think it's the Upstate Dragon Boat Festival. We were the only team to ever flip the boat. But I kind of got to know them a little bit through that one, and had some family friends that worked within the Greenville healthcare system. And once it merged, it seemed like a pretty good organization, and I wanted to come see for myself. My interests outside of the hospital, I like to be outdoors. I love the mountains, so now I get to be a little bit closer here than where I used to be. It's an hour and a half up to Asheville, which is really nice. Recently married, have a golden retriever, and I taught him how to carry groceries inside, and we're getting another one, so kind of like a nice dog mom, and just enjoy being outdoors. The advice I generally give patients would just kind of be open, and don't be afraid to ask questions. A lot of people feel like they may have a dumb question. I'm sure I've asked plenty of those myself where I felt like they were, but they actually ended up being important questions to answer. So just kind of be direct, be open, and don't be afraid to ask anything that you may think that you want to know. If you'd like to make an appointment with me, you are welcome to call the number on the webpage.